Well, there are reports that a standoff between senior officials and unions has brought the Eastern Cape Health Department to its knees. It's alleged that some health workers are no longer reporting for duty and that some patients with chronic conditions are not being attended to or they're being turned away. Now, to discuss this, we're joined by the Eastern Cape's Health Department head, that's Dr. Thobile Mbengashe. Mr. Mbengashe, thank you very much for your time. Firstly, can you just clear this up for us? Is the Eastern Cape Health Department on the verge of collapse as a result of these health workers not reporting for duty?
Not at all. Not at all. I think what's really we're experiencing a very severe community anxiety. And that really includes our workers as well. But what we have done, we've really engaged our unions, and we have actually been working almost on a daily basis to try and resolve some of their fears. I think when it started, everybody says, no, we don't have PPE. And I think that was an expression of fear and anxiety. Now they accept they have got PPE, but they are still absolutely mortified with COVID-positive patients. Our approach is that let's give enough information, let's provide enough training, let's improve the competencies, and let's be able to make sure that we've got visible, clear guidelines about what is it to respond to a COVID-positive patient. And
Dr. Mbengashe, can I just come in there? I'm sorry to interrupt you. You are saying to me that health workers in the Eastern Cape are possibly clueless about how to handle patients who are presenting with COVID-19 symptoms.
Workers in the Eastern Cape are, like all South Africans, extremely afraid of the effect of a COVID. And I think that makes them, in many instances, to make decisions that are probably, in some instances, not informed by science, and some instances they can be regarded as irrational. But I think we are working, workers are getting back, and workers are getting more confident, and we're working with their unions, and we're trying to support them.
Is it true, Dr. Mbengashe, that some nurses in your hospitals there believe that if they are infected with COVID-19, it's a death sentence for them?
That's probably one of our biggest fears. And I think what has really happened is that people have seen images in Italy. People have seen images in US, and people are extremely afraid. And I think the idea that 80% of the people who get COVID positive are asymptomatic and they will recover. And if you look in terms of the provincial numbers of death, we actually have less than 2% mortality from COVID-19. And our recoveries are way over 54% in many of, so we had about 3,927 cases. We have recoveries of 2,123. So this is actually showing to South Africans that COVID, while it is highly infectious, but it can be prevented and deaths don't have to happen, and the health system is actually ready to accept many patients.
Dr. Mbengashe, if you have an apprehensive health workforce that doesn't know exactly what it means to be infected with COVID-19, it means that the populace in the Western Cape, the residents there, they possibly are at risk. Already we are being told that some patients who are presenting with different symptoms or have chronic illnesses are not being attended to. There is a leadership crisis clearly in the province.
No, actually, I think what South Africans should really understand is that I think the COVID impact has been very rapid. I think depending on the social and ecological areas and the bigger belief systems within communities, it is very difficult to really comprehend how a disease where everyone is susceptible, everyone cannot really prevent themselves unless they do the basic things of making sure that they are wearing their mask, they are washing their hands, they are isolating. And I think people have experienced death, they have seen death, and actually our death in the province so far is around 80 people who have died from COVID. Obviously, there are people who died who could not have diagnosed. But I think the biggest thing that we're really working on is that we should build confidence, we should build competencies, we should make nurses to know that if they are wearing full PPEs, they're really doing the infection control, and they're actually doing the things of really sanitizing and keeping the protocols about how to manage patients, that would be okay. I mean, for instance, we have less than 250 patients in our hospital. Yeah. So we have not really experienced a surge of patients in our hospitals.
Dr. Mbengashe.
So it is really a fear that we're working with union, and I think everybody have recognized that we must support our nurses, we must provide support, and we must train them and create a level of confidence.
Dr. Mbengashe, there is concern that the numbers that you are talking about, whether it be those that are sitting in hospital right now as a result of COVID-19, it may not be a true reflection of where the Eastern Cape stands, and that's primarily because of the testing that has now been delayed as a result of the testing equipment that is not readily available in the country. Talk to me about the percentage of health workers who are sitting at home right now throughout the entire province, and perhaps that will be a determinant about whether or not it is true what Nehao is alleging, that there is a potential crisis in the Eastern Cape, that the system there might collapse.
Yeah, we have about 191 workers that have been affected and infected by the coronavirus that are in isolation right now. And that actually, the biggest issues now, what South Africans require is really to understand whether government policies and interventions are actually appropriate. And one of the very good measure, which I think that all of us should now adopt, is the stringent index. Now, with the stringent incident, you can really tell whether in 100 days of interventions, how a country, how a province, how a district is actually working, and what you need to do. So if you look at our health workers in relation to the number of health workers, because in relation to the number of workers, when you look at a community level of 3,927 people affected, it actually proportionally shows that it is not the health facilities that's creating the infection, it is what's happening in the communities. But the health system itself must make sure that no one gets an infection unnecessarily. With proper protection, we reduce the number of infections, and that's what we're doing.
Dr. Thobile Mbengashe, thank you very much for your time.